So your doctor has determined that it's time for an MRI, and you probably have some questions about what that means. In this short video, we're going to help you learn how the MRI works and what you can expect as a patient. Now you're probably asking yourself, what exactly is an MRI? The term MRI is short for magnetic resonance imaging. It uses a magnetic field and radio waves to take three-dimensional pictures of your body. It gives your doctor different information than can be seen with X-rays, ultrasound, or CT scans. There is no radiation exposure with an MRI. The exam can be as short as 10 minutes or as long as 45 minutes. It's a fairly painless procedure. Even so, there is a slight chance you could experience some stiffness if you have a longer exam, since remaining still is key to getting good 3D pictures. Many people are surprised to learn that the MRI magnet is always on. As you can imagine, the magnet is quite powerful. That means anything magnetic will be pulled toward the core of the machine, and often with great force. Everyone planning to enter the MRI suite is carefully screened. People who cannot have MRIs are those with pacemakers, aneurysm clips, or any electronically implanted devices. Now that you know what an MRI is, let's talk about what you can expect on the day of your exam. You will be transferred to the radiology department by wheelchair or on a stretcher. Just like a long car trip, you may want to go to the bathroom first. You'll also want to leave your wallet, any jewelry, watch, or cell phone with a family member. The technologist will explain your exam in detail and answer any questions you may have. You will then go over a screening form that includes a series of quick questions about everything from pacemakers to piercings. Your safety is our first concern, and we want to be sure we've covered the bases before you get near the magnet. You will be asked to sign the form and then head over to the MRI suite. Before entering the suite, we'll do one last check for anything magnetic. It's a very similar process to going through security at the airport. Depending on the exam, you may or may not require contrast. IV contrast enhances the images of your organs and vessels. The contrast will be injected either by hand or by a mechanical injector. You may feel a cool sensation up your arm or have a metallic taste in your mouth, so don't worry if that's the case. Now let's talk about the exam itself. We'll warn you up front, the MRI machine is very loud. You will hear sounds such as knocking and hammering. You'll be happy to know that we have special headphones to muffle the sounds. In fact, we even have satellite radio for your listening pleasure. Just tell your technologist your musical preference, and he or she will set you up. The trick to getting clear results is for you to lie as still as possible, just like an X-ray but longer so that we can get those 3D images. We use an open MRI, which means that the machine doesn't enclose your entire body. Even so, some patients experience anxiety or a feeling of claustrophobia. A mild sedative usually helps those patients. If you're worried about this, you should discuss it with your doctor or nurse beforehand so that proper arrangements can be made. All patients are given a call button should you need to contact the technologist during your exam. If you would like a face mask or a blanket, all you need to do is ask. That's really all there is to it. And for as simple as the MRI is for the patient, it is a wonderful diagnostic tool for doctors. So relax. The MRI isn't a scary examination at all, it's just louder than most.